Pat Aaron Show, 95.3 WDA and AM 620. Time for the Florida Orthopaedic Institute Injury Report, brought to you by Florida Orthopedic Institute, Tampa General Hospital, our good friends over there. Make sure if you're dealing with any injury, book an appointment today. Call 1-800-FL-ORTHO or go to floridaortho.com. Let's get Dr. Seth Gasser on the line. Dr. Gasser, how you doing today?
I'm doing great. How you guys doing?
We're doing great. We're doing better than some people here are doing when it comes to injuries in the NFL. I want to start with this because Trey Hendrickson of Cincinnati, their star pass rusher, he left the game midway through the fourth quarter last week against the Panthers dealing with a neck injury. And when I see neck injuries, I get so nervous for these players because you just know how dangerous they are. How challenging are these neck injuries?
Well, you're absolutely correct. They can be quite serious. I think actually what Trey Hendrickson suffered was something called a burner or a stinger, which is less serious than it could have been. And those injuries are very common in football. They typically occur if the top of your helmet or the side of your head hit and your head goes one direction and your arm is pushed the other direction, and they tend to be stretch injuries to the nerves that go down the arm and not the spinal cord itself. Usually you get this numbness and tingling like electric shock all the way down your arm, and these guys come off the field sort of holding their arm next to their side. Oftentimes it's pretty minor and they resolve within 5 or 10 minutes, but sometimes depending on the severity of the stretch to the nerve, they can last sometimes days or weeks. And anybody that has those type of symptoms on both arms, then you start to really worry about a cervical spine injury and not a peripheral nerve injury. So they can be very serious for these athletes, and the return to play depends on the degree of damage.
Obviously, with any injury, you're going to want someone to be healed or as close to it as possible before you let them back on the football field at all. But I'm curious, when it comes to an offensive lineman or a defensive lineman, we see so much with the hand fighting that goes on the lines where a guy's hand slips up and ends up hitting a guy in the face mask, or you see that hands to the face penalty where a guy's just cranking a guy's neck backwards. If you're talking to an athlete, whether it's a young athlete, pro athlete, whatever it is, who is in a position like that where they often get their head and neck kind of cranked around more often on the line than, say, a defensive back or a wide receiver, do you change anything about when you would let them come back, how they will rehab, or anything like that?
So really, it's a pretty simple algorithm for return to play for those burners and stinger type injuries. So the player has to demonstrate normal motion that's pain-free, including their neck and their involved upper extremity. And they have to have normal strength and be able to demonstrate to you on the sideline that they are able to safely do those things required of their position to get back on the field. And if they cannot do any of those things, we do not let them back on the field. They often say, I'm fine, I'm good, but that doesn't affect our decision-making whatsoever. And for all these types of injuries, our main concern is for the health of the player, not the ultimate outcome of the game. And so we're always making that decision in favor of the player to be safe and not risk further serious injury.
Jordan Hicks of the Browns, he's dealing with an elbow injury. Are elbow injuries common? I'm trying to think of, we always hear about, different type of injuries to the arm. How common are the elbow injuries?
So elbow injuries are fairly common. I mean, there was a study in the NFL about 5 years ago that looked at elbow injuries, and over a course of about 5 years, there were 100 players in the NFL that missed some playing time due to an elbow injury. So they're not uncommon, and they can be anywhere from just sort of a sprain or a strain to a potential elbow dislocation, which can keep a player out for most of a season in some cases.
First of all, Dr. Gasser, I think we have to celebrate Aaron Jacobson here for a second, because you may be shocked to learn he actually believes he has a hernia right now. And the fact that we've gotten 2 questions for him into this and he has not brought up his hernia, I think is something to be celebrated. But beyond that, I want to ask a question. It's a bit of a personal question, but I think a lot of Floridians kind of will understand this thought process or have something similar that they're dealing with. When it comes to whether it be your back, I think a lot of people have it in their back, I do, elbow or wrist. If you have something where you're hearing a pop when you do something repetitive that you do a lot, or you hear, you notice kind of like whether it be your wrist or your elbow or your back, you either hear the pop or you feel things moving around in there. Is that something where you have to worry that, hey, there's an injury on the way that might be coming? Or is that just kind of like, hey, bud, this is your body now. You're an old man. You're an old woman.
Is this you? Is this happening to you?
This is a lot of us.
This happening to you, though?
A lot of us.
Okay.
Yeah, good question. So as we get older, we tend to feel more clicks and pops and things like that in our joints. In general, most of those, if they're not related to a specific injury and are not causing any symptoms, are usually benign, meaning they're not anything to be particularly concerned about. If they start causing pain or you're noticing swelling or other symptoms, then it's certainly something that should be looked into.
Anthony Richardson is dealing with a hip injury. Let's step away from that for a second. I can't tell if I'm dealing with a hip injury or if I'm dealing with a hernia, a strain. It happened when I was doing, what are they called, Casey?
Well, you got a bump, right?
Casey, help me, what it's called?
What
I did that hurt myself?
Oh, the snatches.
I did snatches, and I snatched up something in my groin area. Well, it's above it. It's like by the, I don't know, doctor.
There's
what do
a
I
bump,
got?
right?
Yeah. Well, yeah, it's not a big one anymore, but it's a little bit of a bump, a little bit.
You know, snatches are a ballistic movement. They can easily cause muscle strains and sprains. So especially the abdominal muscles, and those muscles attach in that groin area above to the pelvis, to the pelvic bone.
Yeah, it's right by the pelvis. It's on the side. It's like on the by the leg and the pelvis.
The thing that you should be concerned about is potentially having what's called an inguinal hernia, which is one of the most types of hernias, which is a defect in the fascia and potentially the muscle in that area. And if you see a lump there, that usually means you probably have a small hernia now. Sometimes they don't cause symptoms, but sometimes they can be painful or get bigger over time. And that would be something that most people, if they're having symptoms, would have fixed. That can be done by a general surgeon on an outpatient basis. It's a relatively quick operation with high success rates.
I love it.
But if you have a bump, you probably need to get it checked out.
Yeah, I'm going to come see
Does
you
he have to worry
guys.
about sepsis?
Yeah.
No sepsis.
Oh, thank you. Somebody, he's anesthesiologist or whatever they call him. He called the other day. He told me I'm going to get sepsis. I said, I'm going to leave that to our doctors at the Florida Orthopaedic Institute.
So you know what sepsis is, right? That's severe infection where you're sick and need antibiotics, but I don't believe that's the case for this.
All right, thank you. I'm going to come see you guys, but before that, I was planning on playing golf all the time. Can I play golf today?
As long as it's not bothering you while you play, you should be okay.
I love you so much, Dr. Gasser.
I guess you're not going to die. That's good news.
I was going to ask you about my heel, but it took only a couple days. The pain's gone, so I don't have to ask you about my heel anymore. When it comes to football players with the hip, though, Anthony Richardson, how concerning is that? I mean, we're talking about a guy who moves a lot. With the oblique, you're using that a lot when it comes to everything for a quarterback. How concerning is that?
It can be very concerning. So there is a lot of things around that area that can cause symptoms. These oblique strains are the muscles in your abdomen that are on the sides that help you twist and rotate, but they attach down on your pelvic bone. And there's actually something that you've probably heard of called a sports hernia, which is an injury to those muscular attachments on the pelvis that can be quite a problem. Usually it's very common in soccer players, golfers, and some football players.
I might have that.
Most just sort of abdominal oblique injuries eventually heal depending on the severity of the muscle strain and get better. It's those sports hernias that tend to linger and they sort of get better with rehab, but they keep coming back when those athletes get back to their sport. And that's usually something they would address in the off season with a little outpatient surgery to sometimes reattach those muscles.
I might have
been partially pulled off.
That's it. I might have the Anthony Richardson. That's probably what I'm dealing with here, Dr. Gasser. All right.
Yeah, but they don't usually have a lump like you're describing. So most lumps are usually hernias.
It might be a lump that I'm creating in my mind.
Oh, my God.
I'm a little bit of a hypochondriac, if you haven't noticed.
How many of these do you have to deal with?
Dr. Gasser, always great stuff. The Pat and Aaron Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com. They don't know what's just happening with your body. They know everything about everything. I mean, think about it. Dr. Gasser just broke down the exact amount of elbow injuries that have occurred in the NFL. These guys know their stuff. So please, if you're dealing with any injury, go schedule that appointment today at floridaortho.com. Great stuff as usual, Dr. Gasser. Thanks so much.
Thank you.
Thanks, Doc.
I mean, really, they do their research. I love them. I mean, these are some of the best guests we have on because I'm sending them topics, and they're not just looking at it and coming up with what they know off the top of their head. They're doing research on the NFL. These are people that have worked with professional athletes, so make sure you check them out today.